This program is brought to you by Community Trust Bank, Medical City, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome everybody to Platforms, the life-lifting news program for women. I'm your host, Siobhan Palmer. This week we're broadcasting from Medical City Children's Hospital in Dallas, Texas. Today's topic is on their tremendous FACT program. The Fetal Anomaly Care and Treatment Program provides the highest level of comprehensive care for mothers carrying babies with congenital defects. Medical City Dallas's FACT program is one of only a few centers in the nation to provide fetal surgery, pediatric open heart surgery, and other leading-edge pediatric services, all under one roof. Joining me now is a woman who is a big part of why the FACT program here at Medical City Children's Hospital has been a huge success and one of the top programs in the nation. Ms. Karen Muery is the maternal and fetal coordinator for the FACT program at Medical City Children's. Karen, welcome to the program.
Thank you, Siobhan.
Okay, tell our audience why the FACT program here at Medical City Children's Hospital is so important for your patients.
Okay, I would love to. Siobhan, I've had the opportunity as working with moms who are pregnant to start to experience what they feel and how they experience life and birth when their baby's diagnosed with a fetal congenital anomaly. It wasn't but a few patients in that we realized that there's a lot of social and family issues that come along with these diagnoses.
Absolutely.
And so what we wanted to do was really optimize not only the family experience, but also to be making sure that we're really attending to the medical aspects and how we can ensure the best outcomes for these babies. One of the reasons we wanted to do this was to try and limit the number of transports of neonates from surrounding areas.
And when you say neonates, explain to the audience what
that
that
would
is.
be your newborn baby.
Okay.
These are the kind of babies that cannot stay in a normal newborn nursery and usually are too sick to even stay in a neonatal ICU at surrounding areas.
Right.
It's really important for women who are pregnant with babies with congenital anomalies to understand the different kinds of available services at NICUs in neonatal ICUs in the area that they're going to deliver. The problem is if their baby is sick and it's not matched up appropriately with the services that baby needs, then the only option that that hospital has is to transport that baby to a hospital like ours, which is a level 3 tertiary care center.
Okay. Now, transporting a critically ill infant, that's just another trauma that the baby may have to endure, so it's very, very critical in terms of the support staff and the type of transportation and get them here as quickly as possible.
It is. There are some babies that are sometimes too unstable to transport. Then there's always delay to treatment because, as we know, even a helicopter, we have to stabilize a baby and then make sure we get it onto a helicopter or even an airplane. And there's delays to possibly getting some of the needed treatments that they need to make sure that they're breathing and circulating and doing all the things that they need to do during transition.
So isn't it key? I mean, it's what's happening before the baby is actually born. It's so important to identify these congenital defects and then make that decision at that point where it's going to be the best location to give birth.
And that's what this program really is all about. It's really helping these moms once they get to diagnosis to understand how to anticipate as best as we can the needs of that baby and of that family and to make sure that they're delivering in an appropriate area. But not only that, but that there's a plan that's in place and the parents are aware of this and they've had an opportunity to meet with all the care providers that are going to be involved in the care of their baby. On top of that too is sometimes moms have their own problems. We've had mothers who are pregnant that have their own heart conditions. So that's another reason why you want to be in a facility like Medical City where we can take care of the mom as well as the baby regardless of the complex disease processes they both have.
That's wonderful. And we're going to be looking forward to today to talking to the many specialists that are all part of this integrated team here at Medical City Children's. What have you taken away? You're a coordinator and you're right in the middle of this whole program. How has this program impacted you? You're a mother yourself. You're a proud mom of 2 boys.
I am.
And seeing the difference with a program like this versus conventional treatments.
You know, my takeaway is never underestimate the power of a family. And when they're together, to be able to get through tough times and to inspire one another, and then for also that the family and the parents need to be involved in the patient care, the baby's care, and that no one knows what's best for their baby more than a parent. So.
Absolutely. Well, it's a great point to stop. And Karen Muery, I just want to thank you for being on the show. We're looking forward to talking to all your specialists today. If people want to contact you or a member of your team on the FACT program at Medical City Children's, what's the best way to get a hold of you?
Well, depending on how they want to, we can always be reached on our website, and then also we have an office phone, 972-566-2326, and they can get in touch with me right away, and I can help them however they need to be helped.
That's beautiful. Karen Muery, the Maternal and Fetal Coordinator for the FACT program at Medical City Children's Hospital. Karen, thank you for joining us. It's an absolute pleasure.
Thank you very much, Siobhan.
Ladies and gentlemen, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll be back in a moment.